harmony, love, compassion, and living life to its fullest. All words that encapsulate what Catholic Caritas Foundation of Nigeria, also known as Caritas Nigeria, has stood for in her 10 years of existence. These words mean different things to different people. For one person, it's a second chance at health and life. For another, it is a hot meal on a cold day. For yet another, it is the hope that they would have a better tomorrow because of the skills they have learned today.
An koyar mana kasuwanci na tip telo. Mun samu aka rabar mana keke kowa, mun samu muna aiki mu da shi, muna samu taimako, mun sa yaran mu makaranta. A can garin mu an kashe mana mazaje muna rike da mara. Mun samu canje yaran mu suna zuwa makaranta.
They bought an industrial machine for me and some other things to open the shop, generator. They paid for my shop and they have been patronizing me as well too. And this, as you can see, I'm not living very well.
Tarata sai suka bani 30,000. Haka 30,000 nan sai ina juyewa ta wurin alheri da kuma taimakon su kudin nan har yazo ya girma ya kai kusan 150. 150 nan dama akwai kannena mu guda uku ne. Ba mamun baba muna rayuwa da shi. A hakan kuma kannena har na tura su makaranta.
I live my life as if I don't have HIV. That's the truth now. And by the grace of God, I'm a mother of 4 kids.
The drugs I'm taking, I'm healthy. And I feed my children very well. Me and my children, they're healthy.
The stories of Caritas Nigeria's life-saving interventions are endless. From emergency response to humanitarian services, health interventions, anti-human trafficking, agriculture and livelihoods, good governance and institutional development, the well-being of people, families and communities across Nigeria have been greatly enhanced by Caritas Nigeria. This is the story of how Caritas Nigeria has lived a lifetime in only a decade, driven by her vision for a humanitarian society where everyone enjoys fullness of life.
The church was founded by Jesus Christ, and he told us in John 10:10 that he has come that we may have life and have it to the full. He never only preached the gospel, he never only fed people with the word of God. Whatever people needed, even physically, he provided for those needs. And so Catholic Caritas Foundation of Nigeria is that arm of the church, if you like, that walks our talk, namely that makes the gospel message that will proclaim, the word of God that will proclaim a reality in people's life.
Caritas Nigeria is a member of Caritas Internationalis, a confederation of 162 countries providing relief and supporting human development around the world. This specialized relief and development arm of the Catholic Bishops' Conference of Nigeria was established in September 2010.
At our conference, we discussed on how to create Caritas. There are 2 prominent personalities involved in this, apart from the administrative board that I headed. It is Archbishop Joseph Edra Ugo, the retired Archbishop of Calabar, and Bishop Ugorji. Bishop Ugorji studied in Germany. He knew the runnings of Caritas there. He had a passion for it too, technically. And the 2 of them with us prepared the grounds for Caritas Nigeria. And of course supported by so many other bishops. But they are the cardinal persons in the establishment of Caritas Nigeria.
In 2010, the bishops of Nigeria interviewed me and gave me the mandate of beginning Caritas Nigeria. And by September 22nd, we were able to formally register Caritas Nigeria as an incorporated trustee in Nigeria. We modeled our systems and processes like Catholic relief services.
I was working for Catholic Relief Services, or CRS Nigeria Country Program, as a senior institutional strengthening advisor. And I was assigned by my bosses at CRS to work with Father Bassi to get the new organization up and running. CRS gave a small grant for the young Caritas to start working on HIV/AIDS programs in Benue State.
With a small grant for about $50,000. And that was all that they needed in the first year. And they didn't even spend all of that. In the second year, they received additional funds through public donors with the help of Catholic Relief Services.
CRS and Caritas are very much sister agencies. We've worked together in combating HIV/AIDS. We've worked together in supporting orphans and vulnerable children. We've had a large agricultural livelihoods program. Programs that are geared towards meeting the needs of the poor, and not only that, but investing in their capacities.
So we started from that humble beginning with these few facilities under the AIDS Relief Project. Subsequently, we got another grant where we are a kind of sub-recipient with Chan as a principal recipient. And that was the Chan Charis project. We got our first grant as Caritas Nigeria, which was the Sustain project.
Sustain is an acronym that stands for Sustainable HIV Care and Treatment Action in Nigeria. When it was, the RFA came out in 2012, it was written by staff of Caritas Nigeria. Then we were about 8 or so 10 technical staff that were in Caritas Nigeria, and we decided to take the bull by the horn, and we wrote that grant ourselves. I remember the grant, we had about 2 months to write that grant, and then the 6th week, we had worked for about 6 weeks. The 6th week, one of the evenings after we had finished working, I was going home, and I stopped over somewhere at Wuse to get some things, and by the time I went in and came out, I noticed that my car had been burgled. The laptop, everything that was in the car was stolen, and that meant that everything we had worked on for 6 weeks was stolen. And we just had 2 weeks to the due date for submission of that grant. And I immediately called the then Executive Secretary, Father Bassi, to tell him what had happened. And everybody was taken aback. But when we got to work the following day, we started writing all over again. So it took 2 weeks of working day and night to put back the proposal together. And as God would have it, on the due date, with support from CRS packaging and all that, we were able to submit that grant. And fortunately, we awarded the grant. The focus of that grant, we were allocated to work with faith-based hospitals and partners across the 12 states that CDC was working then. And it was a 5-year grant. It ended in 2017. And in the course of that 5-year grant, we were able to test about 4 million persons across the 12 states and placed about 65,000 patients on treatment. And I think we also reached about 34,000 children, orphans and vulnerable children, in the course of that project, and placed. And then we also reached about 260 pregnant women were tested and tested for HIV, and about 12,000 were placed on life-saving treatment to prevent them from infecting their babies. And that was a huge success for us, being the first project.
So outstanding was the Caritas Nigeria's performance that in the follow-on grant, which was highly competed for, Caritas Nigeria was one of the 4 selected IPs to continue HIV programming in the country. This time around, the organization in October 2012 began the implementation of the 4-Gate project. This program sees Caritas Nigeria supporting 4 states, namely Delta, Enugu, Igbo, and Abia State.
4-Gates is global action towards epidemic control in some national units in Nigeria. It's a comprehensive HIV care and treatment and prevention project funded by CDC. 5-year project. It's actually in its 5th year. And in terms of strategy, we're using what we call the surge to achieve the UNAIDS 95-95-95 goal, which involves placing 95% of people living with HIV on treatment, that they first know their status, they are on treatment, and they are virally suppressed.
You Equals You messaging is a message of love, hope, and peace for people living with HIV. It tells them that if they are on treatment and they remain on treatment and achieve sustained virological suppression, they are unable to transmit HIV to their loved ones. Undetectable equals to untransmittable, and for the purposes of this, the cutoff mark is less than 200 RNA copies per mil. We've leveraged on using one-on-one communication with our patients at every forum. We break it up in trainings, we use billboards, we use radio jingles, we even have TV slots. And then another thing is almost everything I wear for work, and most of my team as well, has You Equals You on it. So it's a great conversation starter.
In the last 11 months of this particular grant we're running, we have tested over 1.2 million persons for HIV. We have diagnosed over 60,000 persons that are positive. We have linked about 64,000 on treatment just in the last 11 months. We are currently taking care of over 154,000 patients that are living with HIV in 3 states. It is worthy of note that for those of them that are eligible for viral load to measure their suppression levels, we have covered over 90% of such, and we are recording a viral suppression of 94%. So we are hoping to move that number close to 100% as possible.
So far, Caritas Nigeria has supported over 300 Catholic health facilities, about 250 health facilities owned by other faiths or denominations, private and government, to provide health and TB services across 27 states in Nigeria. Caritas Nigeria HIV and Health Portfolio alone has provided HIV testing, prevention, care, treatment, and support to over 7 million persons and over 200,000 orphans and vulnerable households. TB diagnosis, treatment, and care to millions of Nigerians. Its HIV/AIDS intervention currently supports over 130,000 persons living with HIV by providing antiretroviral therapy to them, sometimes right at their doorstep.
There have been a little apathy on the part of our people to go to hospitals. So the program has adopted a community testing strategy, sending our workers into the field to test people at their homes and offer services right there.
To make it convenient for them also, we try to, as much as possible, to take services to the closest place to their living area.
We normally beg them, even go as far as going to their house to send the drug to them. At times they come with Okada or Keke. Then the Okada will wait for them. Then we pay them back so that the man will take them back to their different homes.
Our interventions have a major goal of ensuring that the poor and vulnerable populations of our community have increased access to care and support services that would keep their families healthy, safe, schooled, and stable.
We develop other case strategies that will be able to improve our performance in terms of case identification and even quality of programming in the state.
Caritas Nigeria supported the faith-based health providers in 20 states in Nigeria. So, and within the 2 years of the grant, about 12,000 TB cases were identified from those faith-based facilities, and about the same number commenced on treatment, which was a remarkable increase, with about 400 and something health facilities, faith-based facilities, engaged to provide the services, in addition to over 1,000 what we call the spoke facilities, because The PPM-TB project is modeled in the Hub and Spoke fashion.
We bought equipment, installed equipment, trained laboratorians to be able to use this equipment, and ensure that services rendered were free.
They supplied us like refrigerators, working equipments like instruments in the lab. They even put an exhaust fan for us at the lab. In fact, we've benefited a lot from them.
Apart from its huge impact in the health sector, Caritas Nigeria has provided humanitarian intervention to over 5 million people in Nigeria. Caritas does this through direct food aid, non-food items, health services, unconditional cash transfers, income-generating activities, vocational skills acquisition, savings and internal lending communities, water, sanitation and hygiene services, agric input to support farmers, nutritional support to acutely malnourished children, and education in emergency.
All our humanitarian interventions, we aim at ensuring that there is participation from the people in need, the communities we are intervening in, so that they take ownership and are able to ensure that whatever interventions we deliver are sustainable and actually take them out from their need.
Our main strategy has been community participation, involving the persons of concern in issues and decisions that concern them. A lot of work has been done. There's still so much more to be done, but so far we have done a lot to mitigate the incidences of child abuse, the incidences of sexual and gender-based violence. More children are in school now. We have also been able to provide assistance to persons with specific needs as well. We've also been able to provide justice to victims of either abuse or assault.
We have donors like Caritas Norway, who have received funding from the Norwegian Ministry of Foreign Affairs, basically supporting us with this project. We have also worked with UNHCR, whom we have received funding to do some VIP latrines and boreholes and what have you. We have so many donors.
Now, under this project, which is directly funded by the German Foreign Office, we have been able to meet the needs of 7,223 households against the planned number of beneficiaries, which is 1,950 households, so greatly surpassing our initial target.
In 2016, we were able to screen 94,000 individuals comprising pregnant, lactating mothers, and children under 5 with acute malnutrition. And all were referred to the appropriate location for proper management. In 2019, we won a grant with UNICEF to manage a stabilization center in Bayo and Shani.
Caritas Nigeria has been partnering with UNICEF for almost 3 years now, and with the aim of improving the protection and assistance to persons of concern through livelihood support. All these persons of concern have been trained in best agronomic practices, livestock management, skills acquisitions, financial literacy, and they have all been empowered.
Amazingly, under this agriculture and livelihood scheme, Caritas Nigeria has supported hundreds of farmers with improved varieties, access to market, and financial support to vulnerable households to improve their agribusiness.
One good innovations that was done on this project was introducing the organic fertilizer farming technique to the POCs, which has really helped them in curtailing the banning that was made by the military in the Northeast.
We have many other innovations, IT innovations that we've been using in the organization. For example, we have the one we call our paperless workflow management system. So what we use that one is for filling forms and sending forms for signatories.
On the savings and internal lending communities, several groups were formed. We also trained supervisors on how to mentor the persons within the group so that they're able to save over a period of time, and during their share out, Feed the Future target was about 52,000, but in all, at the end of the project, we were able to surpass that target and we reached over 54,000 persons. Feed the Future project was funded by the United States Agency for International Development, USAID, and the program ran from 2013 to 2018. Caritas Nigeria was in partnership in a consortium with CRS and Mercy Corps.
In terms of capacity building, the project has so far trained well over 530 staff and volunteers from the 9 provinces. And this is done in key focus areas, including project management, resource mobilization and proposal writing, financial management, monitoring, evaluation, and learning, as well as administrative functions.
Our capacities were built by Caritas Nigeria in the course of carrying out this work. Even in the administration of our project, things have changed in terms of our accounting systems have been strengthened. Our program systems have also been strengthened, bringing it to a level that Caritas operates around the world.
Caritas Nigeria actually have been working with us in area of different interventions, especially strengthening our capacity, institutional capacity, and as well reaching us during election and human trafficking.
Human trafficking, a form of modern-day slavery involving the illegal trade of people for exploitation or commercial gain, is believed to have Nigeria as one of its largest human trafficking hubs in the world. But over the years, Caritas Nigeria has launched anti-human trafficking and irregular migration interventions that have saved lives and improved the livelihoods of vulnerable groups and victims of human trafficking, and returned migrants through skills acquisition initiatives. Psychosocial support, savings and internal lending communities interventions, as well as supporting communities to establish community watch groups to further sensitize communities on the dangers of human trafficking and irregular migration, and also to report traffickers to relevant agencies such as NAPTIP.
We are all aware of the incidents of human trafficking across Nigeria, and then the fate of Nigerian youths who try to travel to Europe illegally, and when they are unable to and become devastated, we have a unit that takes care of their psychosocial support, and then there's the skill acquisition programs in order to re-establish them in their various communities.
Essentially, we have 4 projects. One is just closing out under the Migration and Protection Unit. We have the STEM project, which is Stable, Trained and Empowered Migrant, which essentially looks at reintegration of irregular migrants back into their home communities, people who migrated irregularly or were trafficked to Libya and European countries and have been returned. So we essentially train and empower them by giving them startup tools for businesses. So far, over the last 2 years, we've been able to train 735 people in different vocational skills. We've also provided shelter for over 200 returnee migrants who did not have a place to stay. We've provided health insurance for over 350 returnee migrants, and we also provide mental health and psychosocial support to virtually everyone who comes in contact with us.
For the educational support, we're able to support 523 students who were out of school, while for the livelihood support, we're able to give 500 women households in Edo, Delta and Cross River State, support them with grants of 50,000 naira each for an income-generating activities. We had school campaigns, church campaigns, campaigns in the mosque. We are able to reach over 60,000 persons in trying to raise awareness on the use of human trafficking.
Beyond raising awareness, such campaigns are also geared towards helping gatekeepers and community leaders to take responsibility for their community members and practice good governance. Caritas Nigeria's remarkable support for grassroots mobilization and several advocacy initiatives has promoted a people-centered governance in most communities, including peace-building initiatives and election monitoring interventions across Nigeria.
The Good Governance Program, as we have it under Caritas thematic area, aims to create a transparent and accountable society where citizens will participate in making decisions that affect their lives, so that they will always be carried along where government policies and issues are concerned.
We've been able to interact with government at the national level and specifically at the National Assembly in the upper chambers, that is the hallowed chambers, the Senate, as well as the National Assembly. Basically, we've participated actively in committee, in debates, activities, and then in legislations that have to do with bills.
In just 10 years, Caritas Nigeria's interventions at national, state, and community levels have truly transformed the lives of those most in need and vulnerable groups in hard-to-reach communities, regardless of religion, ethnicity, or political affiliations. But Caritas Nigeria believes that this was only possible because of its continuous collaboration with its esteemed partners and relevant organizations.
We have been working with the American government and its people through the CDC, Atlanta, CDC, Nigeria. We're working with CRS, Catholic Relief Services of America. We've been working with Miserium. We're working with CARFORD. We're working with the United Nations and in its various agencies, the USHR, the UNICEF, and then World Food Program too, are also parts of our collaborators and agents. They also work with other church intimate structures like the JDBCs and other CSOs in their various capacities.
As we thank those who are helping us and will continue to appreciate what they do for us, I think my number one vision is to be able to see that we improve remarkably on our internally generated revenue, so that when emergencies do arise as they do, both local and international, we should be able to respond to them with our local resources.
Starting from having just one office here at the Catholic Secretariat of Nigeria complex, we have now, and just one project as at then, we have now expanded to the level that we have implemented over 60 projects in the course of 10 years. And we have more than 8 projects running concurrently, presently, I must say. And then also we have expanded to other states. We have offices across the different states in the southeast, in the northeast, and in Cross River State, as well as in Edo State. So it's been awesome, I must say. And we also have over 500 staff and volunteers working across these projects across different states, reaching out to those most in need.
The landmarks have been awesome. In just 10 years, and they've been able to achieve all that we are seeing today. I'm certain that with the good leadership we've enjoyed and that we'll continue to enjoy, we will get to the point at which other implementing partners and other organizations will look up to Caritas Nigeria and say, yeah, this is one organization that has actually succeeded, and this is one organization that they would want to emulate in future.
With the kind of committed leadership we have, with the kind of committed staff, with the investments in trainings and all that, in 10 years' time, I see Caritas becoming a household name all over Nigeria and beyond the shores of Nigeria.
Caritas, from what I've seen, after 10 years, is in line with the recommendations that were made by the committee. So much has taken place and beyond. I will say that Caritas has even gone beyond what we envisage. I think the bishop took the right decision and Caritas is living up to expectation.
Thank you, Caritas Nigeria.
Thank you so much.
Caritas, mun gode ma 'yan Caritas. Na gode musu da kaunan da suka nuna mana.
I really appreciate Caritas Nigeria. May the Lord bless you.
Muna godiya mu mun gode wa Allah. Ubangiji kuma ya daga ku, mu kuma ku sake taimake mu.
When we look at the achievements of Caritas Nigeria, there are many reasons for us to be proud with you and for you. You have perfectly understood that Caritas is not a business. Caritas is a mission.
Pope Francis said, "The poor deserve the best." It is our duty to offer the best to the poor. This is precisely what Caritas Nigeria is doing, to bring the best to the poor, as in the parable of the Good Samaritan, who searched for all means to give the best care for the wounded man.
Caritas Nigeria works in the most hard-to-reach communities, areas where few other organizations operate. You reach the most in need, and you do it with a combination of compassion and professionalism.
As we celebrate Caritas Nigeria's decennial under the theme Empowering Communities to Eradicate Poverty, I would like to state again our appreciation for Caritas Nigeria's commitment to the cause of the most neglected individuals across the country.
I want to salute those who initiated the idea of creating Caritas Nigeria, those who work tirelessly to see that it comes to existence, and those who are still currently working with Caritas. An appreciation also goes to the leadership, the current leadership of Caritas Nigeria, for piloting the affairs of Caritas Nigeria very well, for bringing other JDPC families together.
Building on the achievements of the last years, we wish Caritas Nigeria all the best for the next 10 years ahead. We are looking forward to continuing our cooperation and are excited to see what Caritas will be able to achieve in the decade ahead.
I wish you all the best for your next 10 years. I wish you a lot of success in your projects, in your very, very important tasks. And most of all, please all stay safe.
We wish you a blessed and joyful celebration and look forward to continued cooperation. Thank you very much.
No so long time ago, there was a small town that harvest food, where they received a meal. After being sure that people get what they need,
they gather happy and joyful and humble in their acts, which is the sign of the presence of our living God. I'm done with this world.